Hey everybody, it's Ron and Rosa. I brought my wife, my lovely wife, to
Hi.
my throat cancer story. And you'll have to speak closer to me because the mic's over here, but it'll probably pick you up. Oh, look, it's like it was meant to be. Hey, so my last video, I was walking, and there were some clues on that video that would paint a story that is to be, has become, and now is. Some of you that saw it might have remembered that I was talking about how weak I've become, and it was hard to hold the camera with the one hand, my right hand, and I had to switch to my left hand. And I was also complaining that my heel was hurting, and it was. And through that week, after that day, it got really hard to walk. And so basically, I felt like this Achilles thing from my ankle injury in October had come back. And it did. And I was going to a physical therapist who was working on it. And my foot got really swollen, really puffy. So I let all my doctors kind of know, Dr. Abelson. And he was like, yeah, you know what? With your history of pulmonary embolisms, why don't we get an ultrasound on that to rule out a blood clot? And Rosa always loves hearing, oh, blood clot. Oh, that sounds fun.
Nope.
So that was on a Friday. So the Friday after the Monday, when I did my last video, and their office called and said, well, the soonest we could even find one for you is on Monday. And I thought, well, isn't that some crap? And I was just on my way home from physical therapy. Actually, no, I was on my way to physical therapy. And I said, well, I'll talk to my physical therapist. And as soon as I told my physical therapist that my oncologist wanted me to have an ultrasound to rule out a blood clot, well, the last thing he was going to do was touch my foot. So he worked on my shoulder. And what had happened was my shoulder started developing pain that was radiating down. And it was going up my back, and my neck was sore. And I thought, oh my gosh, what have I done to my shoulder? And we were at the beach Saturday, but I mean, we lifted little bitty rocks, but I didn't pull anything. So two things happened on that Monday. That's not my heel, my left heel and my shoulder. So the heel got really intense, and my physical therapist worked on my shoulder. He said, yeah, you're really tight. And for the next few days, I would have a very, very uncomfortable time with my heel. I mean, it was painful. I had to go back on my crutches. And that Friday, I was just like, you know what? I'm going to go home and make myself some eggs, and I'll go to the hospital. So I drove myself to Los Robles Hospital. And as soon as they heard my history, they got me checked in. They did blood work. They did an ultrasound. They did chest x-ray, x-ray on my ankle. They did a CT scan. I mean, they just worked it up. And everything was negative except my heel, which showed that there was like this bone spur. It's called Achilles tendon ethosphite. Okay, that's good news in many ways. And they said, don't let your physical therapist rub on that tendon, and get on crutches and stay off your feet. That's what all medical professionals do. They say, stay off your feet. Fine. So got home that afternoon, and literally next couple days, I was using crutches. It was pretty painful, wouldn't you think?
Yep.
I mean, crutches to get up and down the
Yes.
stairs, and yeah, and really very little flex.
It's kind of like babies doing like first stop. You need to stay behind.
That's just aging. Babies and aging, same thing, Rosa.
Well, I try to be very more. I don't know.
Yeah, it was like baby steps. Yeah, I know. It was. It wasn't pretty.
Yeah.
So at the same time, my shoulder was getting more and more painful. So as the foot was sort of easing up a bit, the pain of the shoulder was increasing. And there were 3 nights I had to get through because my ortho appointment for my foot wasn't till this morning. So basically, the pain in the shoulder, I was like, oh, I wish I'd done the shoulder ortho appointment first. I've canceled that appointment, and you're probably going to be shocked as hell why I canceled my ortho appointment for my very painful shoulder.
Yep.
And you're going to find out very soon why. So I see my ortho doctor this morning, and they give me these heel inserts and told me to do these exercises. That's a very common thing for old farts like me. I think that's what she was trying to say, but she didn't use those words. And we talked a little bit about the rash and stuff that's on my arms. And so I went to the pharmacy, got back to Fillmore, went to the pharmacy, and got my meds that she prescribed for me for inflammation. At the same time, while I was at her practice, I phoned my doctor's office here in Fillmore and said, Dr. Hodgson said, slip me in somewhere today so he can see me. And they did, 1:30. And we talked about the foot a little bit. We talked about my hospital visit a little bit. We talked about my shoulder, which she takes a look at afterwards. And I said, hey, Michael, I've been reading up quite a bit on these things I have, and it sort of points towards shingles. He goes, well, normally it would be just one side, Ron, but you have it sort of on these little rashes and things on both sides. And he goes, knowing your history, 100%, you have shingles. I guarantee you, you do. He goes, you have to understand, with your immune system so compromised that your body couldn't fight this off. He said, whether I had chickenpox, I don't remember having chickenpox ever in my life. I even called my brother Ryan, who says, I don't think you ever had it. He never had it. And we were together all the time as kids. So if one of us had gotten it, the other one probably would have too. And he says he's been around other people with chickenpox. He never got it. We both had the measles, but I don't remember having chickenpox. It doesn't matter now because the virus that I have is from something. And so, yeah, I have shingles. And my life's going to suck for the next 10 days to 2 weeks. But that's okay, because I have opioids to help me, which I'm going to take whether I hurt or not at this point. I have these big giant pills that are to treat viral infection twice a day for 10 days. I have cream that Rosa just applied everywhere that I have these little things. And I have a med pack for inflammation that my ortho said is going to benefit you no matter what you have, but she thought it was shingles too. So there you go. So why is this important with my throat cancer story? I guess when your pharmacist says, hey, you should be vaccinated for shingles, you should probably just listen and do it. But I was all caught up in my treatments and trying to recover from that. I had planned on doing it. I just wanted to get past some of this crap. Well, this is why I'm making this video, and this is and I haven't seen anyone else talk about this. And so for people that are going through cancer treatments, radiation, chemo, your immune system is going to be effed. It's just going to be effed. And anything that's dormant in your system, inflammation, whatever it is, your immune system that's compromised, those little nasty things are going to go, hey, here's a sweet target. And they're going to go attack it with a vengeance. And you feel fine. You feel invincible. But it's going to get you. If I hadn't had cancer, I wouldn't have shingles now. My body would have fought this. So for the people getting the treatment, you need to be up to date on some things like the shingles and also the pneumonia thing. There's a preventative vaccine for pneumonia that you might want to talk to your healthcare provider about, because when you get in your 50s, this is sort of that sweet spot where if you had chickenpox when you're 7 years old, this is when it may come back. I got bit in the ass already from HPV virus with throat cancer, and I just feel like you feel like you're making a right turn when you should be making a left turn, or maybe I got that backwards. But the point is You've got to take care of yourself. And it's a personal thing between you and your healthcare provider and what you feel is best for you. But this is going to be a rocky road for me. Throat cancer is rocky enough. But what's bizarre is the neck healed. That's great. The throat is getting so much better. I'm eating now without the lidocaine. And trust me, we thought the reason I was getting these hives was from lidocaine patches for my pain, which wasn't really helping. And the stuff that we're putting on my blisters, sores, or rashes is lidocaine, the thing that we thought I was allergic to. Yeah. But guess what? I've never been allergic to anything in my life. So it makes sense. And the shoulder, let's come back to the shoulder. What's wrong with my shoulder? Probably not a damn thing. The way shingles works is it attacks the nerve system and it can radiate pain. My ear's been achy on this side, sort of like it was earlier from the nerves, from the cancer in the lymph nodes. I've been getting like little earaches over here and headaches, which all is part of the symptoms.
No fever.
No fever. All of my, I don't know if you can see it, but
Liver down.
yeah, you can see I've got some there, and then there's a little trail. I don't know if you can really see it or not. Try to bring it in, but it's mostly on my arm, and yeah, it's not pretty. Looks like a little track. Started with like 3 bumps, and we thought it was an allergic reaction.
Yep.
No, it's yet another virus. It's shingles. So I am to stay out of the sun, stay indoors, don't be around little children, because if they haven't been vaccinated, it could be bad for them. And I don't know what I'm going to do. I mean, my right arm is now holding the camera, which is good. I don't know if can I get any work done? I don't know. I may just have to go on state disability. I pay into that crap. I mean, honestly, what do you do, right?
Take care. Yourself. Keep going. Do the instructions.
Yeah.
What the doctor said. Mm-hmm. And be positive all the time. I know it's sore, it's that, but be positive.
Be positive. You heard her. She said, be positive. I'm going to be a whole lot more positive as soon as I start popping opioids, which I've not had to do until now. Yeah. This is sort of a punch in the gut, this one. So you may not hear from me.
Punch in the gut. Maybe God is telling you, what, to working too hard, you need to slow down, or maybe you need to sit down. I know you sit down in the office, but you need to
I would like relax, for God. I would like that to be the message for God. But what I hear is, you played with too many girls when you were younger, and you were a rock drummer, and you did bad things. That's what I'm hearing. Oh, did I just say that out loud? To me, it's a penance. I am paying for my sins. It is what it is. I'll be fine. I'll make another video later, but I'm pretty sure.
Because I have this one, in this case.
I'm sure I will not be making any personal appearances over the next 10 days, because I don't know how much worse this stuff gets. The sooner you get the, what is this stuff called? Baklava? No, it's called Zoltrex. Zoltrex is the medicine. Oh, hell, Valacrovir, whatever. Some of you will know exactly what it is. So anyway, if you're in your 50s and you haven't had your shingles vaccination, and I'm probably the only one in the world who hasn't, my doctor said something. We were both trying to think of the name. He says, Ron, you're the kind of guy that if it's going to happen, it's going to happen, and you worry about it when it does. And he makes a big point. And he goes, it's like that girl's name. And we couldn't think of it. I said, yeah, but it was in Interstellar. That was the daughter's name. And it just came to me. Murphy's Law. I am living Murphy's Law. And you're on a ride with me. You're in it with me. You're invested if you're watching this. So, hug your kids, hang out with family, do good things. I'll see you later. Any final words?
Bye.
That's a good one. Bye.
Have a good day.